Chronic low back pain is a leading cause of disability worldwide, affecting millions and costing billions in healthcare each year. Yet for most patients, the exact cause remains elusive, often labeled as nonspecific. Recent research, however, has brought attention to vertebrogenic back pain, a subtype that may have been overlooked. This pain arises from structural and inflammatory changes in the vertebral plates and bone marrow, and is closely linked to what are known as Modic changes. These changes, visible on MRI, are now being studied as potential indicators of vertebrogenic pain. In this video, we'll explore what Modic changes are, how they relate to back pain, and why they matter for diagnosis and treatment. Modic changes, often abbreviated as MCs, are specific alterations seen in the vertebral bone marrow and in plates on MRI scans. They are classified into three types based on their appearance. Type 1 indicates inflammation and edema, Type 2 shows fatty replacement of bone marrow, and Type 3 reflects sclerosis or hardening of the bone. These changes can exist alone, in combination, or even shift from one type to another over time. While their presence is strongly associated with back pain, especially in the lower lumbar spine, not all Modic changes cause symptoms. Understanding these types is crucial for clinicians to interpret MRI findings and tailor treatment strategies for patients suffering from chronic low back pain. Development of Modic changes is a complex process involving mechanical, inflammatory, bacterial, and even autoimmune factors. Damage to the vertebral plates, whether from trauma, degeneration, or chronic stress, can disrupt the local environment. This leads to the release of inflammatory cytokines and attracts immune cells, causing changes in the bone marrow. In some cases, low-grade bacterial infection or autoimmune responses further fuel the inflammation. These processes not only alter the bone structure but also stimulate pain pathways, particularly through the basivertebral nerve. As a result, Modic changes are not just radiological findings, they reflect real, ongoing biological activity that can generate pain. Several risk factors increase the likelihood of developing Modic changes. These include male sex, older age, diabetes, genetic predispositions, spinal deformities, and lifestyle factors like smoking and obesity. Modic changes are most commonly found in the lower lumbar spine, especially at the L4-5 and L5-S1 levels. Interestingly, they can also be present in people without symptoms, though their prevalence is much higher among those with chronic low back pain. The size, type, and location of Modic changes can vary, and sometimes multiple types coexist in the same patient. Recognizing these risk factors helps clinicians identify patients who may benefit from targeted imaging and interventions. Link between Modic changes and back pain has been the subject of intense research. Type 1 Modic changes, which reflect active inflammation, are most strongly associated with pain and disability. Studies show that patients with Type 1 changes are more likely to experience persistent, severe pain compared to those with Type 2 or 3. Presence of Modic changes, especially in the context of end plate defects and disc degeneration, suggests a vertebrogenic source of pain, meaning the pain originates from the vertebral body rather than the disc itself. This distinction is important for both diagnosis and treatment, as it can guide clinicians toward more effective targeted therapies. Magnetic resonance imaging, MRI, is the gold standard for detecting Modic changes. Advanced MRI techniques such as diffusion-weighted imaging and water-fat MRI can help differentiate Modic changes from other conditions like infection or neoplasm. In addition to imaging, researchers are exploring blood biomarkers that might indicate the presence or activity of Modic changes, though no definitive markers have been established yet. Accurate diagnosis is crucial, as it helps distinguish vertebrogenic pain from other causes and informs the choice of treatment. As imaging technology and biomarker research advance, the hope is to improve both the detection and management of Modic-related back pain. Treating vertebrogenic back pain associated with Modic changes requires a tailored approach. Conservative treatments like physical therapy and medications may help, but for many these are not enough. Intradiscal steroid injections can provide short-term relief, especially for those with Type 1 Modic changes. More recently, basivertebral nerve ablation, a minimally invasive procedure that interrupts pain signals from the vertebral plates, has shown promising results. Studies report significant improvements in pain, function, and quality of life, particularly for patients with Modic Type 1 or 2 changes. However, patient selection and careful diagnosis remain critical for success. Despite advances, many questions remain about Modic changes and their role in back pain. Not all patients with Modic changes experience pain, and the reasons for this variability are still unclear. Standardizing diagnostic criteria and developing reliable biomarkers are ongoing challenges. Future research aims to better understand the pathogenesis of Modic changes, identify which patients are most likely to benefit from specific treatments, and develop new therapies that target the underlying causes. As imaging and molecular techniques evolve, clinicians hope to refine the diagnosis and management of vertebrogenic back pain, ultimately improving outcomes for patients. Summary: Modic changes represent a significant advance in our understanding of chronic low back pain. They offer a window into the structural and inflammatory processes occurring in the spine and provide a potential target for diagnosis and treatment. While much remains to be learned, recognizing Modic changes on MRI can help clinicians identify vertebrogenic pain and guide patients toward more effective therapies. As research continues, the hope is that improved diagnostic tools and targeted treatments will lead to better outcomes for those suffering from chronic back pain. The story of Modic changes is still unfolding, promising new insights and hope for patients worldwide.